September is AFib Awareness Month, and nearly 3 million Americans are living with atrial fibrillation, or AFib, that is an irregular heartbeat that can lead to some pretty serious problems. So here to tell us a little bit more is Dr. Eric Hemminger, a cardiologist with Denver Heart. I appreciate your time today.
Thanks for having me.
I guess the first question is, what are some major signs of AFib?
Well, to kind of understand AFib, you need to understand what the atria do. So they're the upper chambers of the heart, and they're kind of akin to a booster pump or a turbocharger on an engine. They give your heart a little extra kick, a little extra horsepower. And so when they're not working, your heart can still work, but it doesn't work as efficiently. So not surprisingly, the main symptom of AFib is fatigue, actually, is the most common symptom we see. And also exercise intolerance. Patients just can't quite do what they want to do or what they're used to doing.
Yeah, a great analogy. I appreciate you. It helps me to understand that. Yeah. Are certain people more at risk than others?
Yeah, it's more common as you get older. In fact, most of our AFib patients are in their 70s and 80s, but it can affect just about anybody. It's a very common disease. If you're over 40, you have about a 1 in 4 chance, or 25% over your lifetime, of developing atrial fibrillation, which is the same incidence of your lifetime risk of getting cancer, for instance. So just like most of us know somebody that's affected by cancer, most of us also probably know somebody that's affected by atrial fibrillation. It's increasingly common too with the aging population, because as we get older, we're seeing more and more of it.
Yeah. So once it's diagnosed, what are some of the treatments that are out there?
So we've kind of focused on a couple of realms. The first is slowing it down. So when atrial fibrillation, or AFib, is a rhythm disorder, and often when patients go into it, the heart races, and that can lead to heart failure and other problems. So one of the main things is slowing it down, and we usually accomplish that with medications. Another thing we can try to do is suppress the arrhythmia and try to get the patients back in rhythm so those chambers are functioning normally again. And if those don't work, there are some surgical or more invasive procedures that can sometimes be done to try to keep the heart in rhythm.
And if that doesn't happen, I mean, what can happen if AFib goes untreated?
Well, so it dramatically increases your risk of a stroke, which is the most concerning thing, because when the atria fibrillate, which means they just kind of quiver and don't pump blood, you can form clots in the heart. So patients with atrial fibrillation have 5 times the risk of having a stroke compared to somebody who doesn't. Also triples your risk of heart failure and other serious consequences. So we usually treat with blood thinners to prevent strokes. There's a few other strategies there, but it's an important disease to recognize because it can affect, it can make other heart conditions worse as well.
Well, Dr. Hemminger, thanks so much for your time. And the way you laid that out was really easy to understand, so we appreciate it.
Great. Thanks a lot. Thanks for having me.
Take care. And don't forget, you can watch all of our health interviews right now on CBSColorado.com.